really interested and intrigued into how our brain works, basically. I mean, there was a time where I was really very at a very horrible place in my life. I was, I think, in sixth grade or seventh grade, and that's when I started reading books related to psychology and related to the brain and how you can manifest things and all these things. And I was like, if this manifestation thing works, and if I am actually capable of changing the way I think and I perceive and I see things, and that actually changes my own reality. And this is how people, I mean, different people have different realities, they have different perceptions of everything. Like, for example, we are having this conversation, and I'm sure your head might be racing with hundreds of thoughts and hundreds of more questions. I don't know about those questions because my perception is completely different. Sure.
So hi, officially welcome to BioTale's podcast episode 5. We didn't have our podcast for almost like half a year because of exams and COVID and everything. So first episode in the new year. For the viewers who would be watching, would you like to introduce yourself?
Absolutely. Thank you so much for having me on your podcast. I'm really excited to be your first in 2022. So, hi everyone. I am Dr. Pritisha Saxena. I am a psychiatry resident. I completed my MBBS in 2018, and right now I am doing my diploma in psychological medicine. So, that's about it.
That's great. Before I dive into the deeper stuff and the deeper questions, just a basic question that you might get asked a lot. How has it been working as a doctor in the pandemic, especially like you said that you completed your MBBS in 2018, so a big part of your residency would have been spent in the pandemic.
Right.
So how has it been like?
Oh my God. I cannot tell you how lucky I think I was that I grew. I mean, I was born a little early, so I could complete my studies before this pandemic hit. Because right now, our juniors, the people who are interns, people who are first year residents, they're having it really bad because it's them, because of whom we are able to manage COVID, because it's all them who are working. The big consultants that we see outside is, they are, of course, they are taking a lot of pain, a lot of effort to be as good as possible, but the people who are working in the hospitals with the patients are the ones, I think, who should get the entire credit. Because although they might be working on what their consultants are telling them to do, but the entire labor work is being done by the resident doctors or the interns, or even the medical students. The people who are not yet doctors are also the ones who are working aimlessly, tirelessly, and I mean, for such a long time. It's been so many months that this thing is going on, and it is scary. So I think, yes, I'll say that I'm really lucky, and I do feel lucky that I had no, I mean, I did not have to actually skip my studies, or I had to skip my regular rotations in my internship because of COVID. Because a lot of people who are working in government institutes or in bigger institutes where COVID patients were admitted. So what was done is every department used to be on COVID duty. So irrespective of what subject you are studying, like whatever training that you're getting into, whatever PG program that you're into, no matter what, you have to work in COVID. So that was how it was for all of us, being JRs or being residents during this time. A lot of people skipped their actual work, skipped their own patients to help the COVID patients and help the COVID wards. So I think that's like a very big step down for a lot of us, because it's not just COVID that we have. We have a lot of diseases that we do need to see these patients as well. So these are some challenges, and I hope that this is over soon.
That makes a lot of sense. Even like you're lucky you didn't have to attend online school a lot of my seniors who gave their NEET the past year, they had to attend medical school online. So that would have been weird. Even we hope that it ends soon, because I would be giving NEET and I don't want my first year of college to be online. Um,
Right.
so, a very basic question again: what got you into medicine in the first place?
Okay. I was actually really interested and intrigued into how our brain works, basically. I mean, there was a time where I was really very at a very horrible place in my life. I was, I think, in sixth grade or seventh grade, and that's when I started reading books related to psychology and related to the brain and how you can manifest things and all these things. And I was like, if this manifestation thing works, and if I am actually capable of changing the way I think and I perceive and I see things, and that actually changes my own reality. And this is how people, I mean, different people have different realities, they have different perceptions of everything. Like, for example, we are having this conversation, and I'm sure your head might be racing with hundreds of thoughts and hundreds of more questions. I don't know about those questions because my perception is completely different. I'm sitting in my clinic, I'm sitting, there are some patients coming and going, and what I'm thinking is completely different. So even though we are sharing a time right now, we have different perceptions and our brain is working differently. And that is so interesting. So it just kept going there. And I just wanted to do psychiatry, and I was lucky that my parents wanted me to be a doctor. So that really pushed me. I was like, fine, I'll do this MBBS thing that if you want me to do, but I'm gonna get into psychiatry. That was also another challenge to get into, such stigmatized branch. But it's really wonderful.
I mean, I would applaud you for first of all reading books related to psychology and mind. When you were in sixth grade, not a lot of sixth graders do that. Most of them are busy on their phone these days, and getting into psychiatry and psychology, because even right now things have modernized, but there is so much stigma around it. When you are talking to someone who belongs to a generation older than you, they still believe mental health and mental illnesses as a stigma, like this is nothing, you are spending way too much time on your phone and that's all because of it. So there is a lot related to that, and like it is because of people like you, doctors like you, who are spreading the message that things are getting better and normal related to psychology and psychiatry. How would you describe working as a psychiatrist in 3 words? Because I feel that
In
it
3 words.
yeah, like take your time. I feel it could like I went to a hospital for like touring and seeing how things work, and like I was scared when I went to the psychiatry ward in the OPD department because there was so much happening. So how do you think the 3 words that best describe psychiatry, working as a psychiatrist?
Well, it's number one, it's intriguing. It's going to make you think a lot. It's going to make you question whatever you believe into. Because when you talk to a patient who might be having maybe psychosis or schizophrenia or bipolar, if they are in a manic stage, they will have a very complete different set of symptoms and very complete, I mean, the perception basically changes, the reality changes, of course. And it is not something that we can normally perceive. And yeah, it's intriguing. Second, it's wonderful, I think, because you get to meet such an array of patients with so different issues and such vivid backgrounds. And we feel that we generally categorize these issues into, कि ये अमीरों की बीमारी है. A lot of people think that. But I think it's really not like that. Anybody can get any kind of mental health issue. Anybody can have any other physical disorder. So it is not good. I won't say that I like seeing patients coming. I don't want a lot of patients to be treated under psychiatry, but I do like to see when patients are actually coming in and there are a lot of people who are getting awareness about why it is important, and plus that you can treat these diseases, and this is actually a real disease. Because if you talk to a person who was depressed or who is depressed, they'll definitely tell you that, for a very long time they did not realize that this is actually a health disorder, and this can be treated with either therapies or with pharmacotherapies. So that point that people should understand, or should be made aware of, or should be educated about, that these are illnesses, these are the signs and symptoms of certain illnesses which can be treated. Not everything is, something that you can just get over with a cup of coffee or with talking to your friends or your partner. It's not like that.
Shift of
And the
thinking
third word,
from that it's normal, it's nothing much, to yeah, it's a disease and it needs to be worked upon. That's actually very nice what you guys are doing for it.
yeah, yes, I think a lot of people, like you said, that people older than my age who are not yet aware. But let me tell you, there are a lot of people of even teenagers right now who are really not aware of these things. And that is basically that population who is going to be in their 20s, in their 30s, and be going to be the next future, who are going to, create new jobs. Because right now teenagers are already working because of social media. A lot of people got so many opportunities, and they are doing so good at using Instagram and Facebook and YouTube. Because of such a lot of, exposure to these sites, there is a lot of misinformation as well around, which we blindly believe. Because if you are looking at a person who is, at 2 lakh subscriptions, and you're like, you're risky, I mean, this person has so many followers, and they might be legit. And I have been following this person for like the past 5 years, so I'm definitely sure that, this point is legit and this person is legit. I won't say that every influencer will be wrong, but I'm not really sure that how much a person can know about and how much you should believe. So when we are teenagers, or when we are at that mindset where our mind is actually, looking out for new things, and we are trying to build our own personality, and if we somehow get misinformed about something, for example, about like sexual education, if you get misinformed about, various aspect of sexual education, you will be confused, you will be frustrated. And we don't want that, because these teenagers will be, of course, going through something and becoming adults who are depressed, who are anxious, who are worried, who are maybe psychotic, who are maybe manic, who are maybe addicts. So every age should get this awareness. Because ठीक है, अभी the older generation are some very difficult bunch of people who we cannot make understand, because we are छोटे बच्चे for them, and whatever we are telling them is something stupid. And I like to focus more on people who are going to have their entire future ahead. I'm not saying that the geriatric population or the older population doesn't need that much, but you cannot change somebody's views who had them for like around 40, 50 years. It's very difficult. But if you have a view for like 4 or 5 years, I think I can help that person to, get somewhere else.
Absolutely, that makes a lot of sense. This was actually one topic that I am very interested in: pseudo knowledge or pseudo awareness in people. I have seen, like in my school when things were offline, one of my friends and we were talking about mental illnesses, and some random kid comes up and he's like, "ये तो कुछ नहीं होता, पागलों की बीमारी, पागलों का डॉक्टर होता, psychologist," and all of that stuff. And like after a few years, like recently on social media, he posted a quote or something by a very famous influencer, and that quote was actually misdefining depression and anxiety. So just because influencers are there, people follow them blindly and they're like, okay, they might be knowledgeable. Not that everyone isn't, but there are a lot of people misinforming, and a lot of teens getting that information wrong, and then just having the mindset on that particular information that they have received, which It's scary because right now, if you see, it's fine, but in the long run, as they grow up, they're going to pass the same thing to their kids, and it's absolutely going to mess things up. So even if our elders don't understand, they won't be the future, we would be the future. So it's scary how misinformation works, especially related to psychology. I've seen so many posts saying that if you have these symptoms, you are in depression, or if you have these symptoms, you have anxiety, but that's not how it works. So yeah, a lot of people who have never studied psychology or psychiatry make such posts and they get away with it, misinforming people, which sucks in the long run. Why do you think that there is this big, taboo around mental health, and people who are talking about, some people, parts of people who are talking about it get a lot of hatred because of that? So why do you think this exists in the society?
Long ago, when mental illnesses were there, I mean, they have been since we have humans. But when we started to understand the human body, when we started to understand diseases, and when we started to notice these vivid changes in people, and there is a different kind of behavior other than what is acceptable, normal. So these people were labeled to be, under a possession by a demon or a ghost or a spirit. And it was something related to the spiritual world and some world that we cannot perceive, or we cannot see, or we cannot ever communicate with, the gods and the devil and all of those things. So this idea is still there. I mean, people do come to the clinics and they'll be like, kaan mein hawa ghus gayi. That means that a spirit has entered the body. So these things are still there, and these were like way before. If we started around like 1600 and 1700, when we started to understand how all these things work, it will take a long time for a lot of people to get this information that no, this is no kind of possession and this is treatable. We have movies like Bhool Bhulaiya, which portray this, where we cannot prove anything. I mean, I'm not saying that there is no God and such things don't happen. I don't know if it happens or not. But if I see a person with some signs and symptoms and the person is getting better with medication, I would think that it is much easier to treat this person. Why? Because I know what's going on and I know what chemical changes have been gone wrong in that head. So, but if I don't understand it, if I don't know what mental health is, if I don't know that a little bit of this regulation in your chemicals in your brain is going to make you feel so vivid, I'll be like, हाँ इसको भूत चढ़ गया या इसमें इसमें आत्मा आ गई. And it is, I won't say it's wrong, because it is how people see it. But of course, with people who, even people who have this internet, people who are able to listen to podcasts or watch videos or posts on social media, we are very small population. We feel that we are a very big thing, but my parents are not on Instagram, so that makes two of them. My husband's parents are not on Instagram, so that's four people. So there are so many more people who are not here on Instagram or not on any kind of social media platform. And these are the people who actually need this awareness, because we are all getting aware. We all know that this is happening, and you'll find people commenting on each other's posts that this is bullshit and why are you making people feel that they are depressed. One person from my own school, he is doing something in psychology, and he was the one who had commented on my post that why am I talking about schizophrenia to people, and why am I talking in clinical terms, and why am I making people confused. So I was really I mean, I was like, okay, you are also doing psychology, so you do know how important it is to people to know. And if they have a confusion, they have my comments open, they have my DMs open, they can obviously ask me. But okay, that comment did make me dial down my language a little bit on social media so that a lot more people can understand that what I'm talking about. But we do get backlashes from people in our own profession. And I mean, that is something which I think every profession has to go through. I mean, it's just not mental health. For every disease, you'll have a ghar ka nuska. Like for a toothache, I know that you have to go to a dentist. You need to check your teeth. You need to get an X-ray done, and maybe you need a root canal. Maybe there are cavities, or maybe there is some other gum issue. But nay, just you eat a clove and everything will be perfect. That's like the ghar ka nuska that a lot of people do, and they take months to go to a dentist. So every field has this problem. I mean, they go through these problems of people doing things by themselves and messing it up more. So then the doctors have to prolong the treatment because the condition is now worse.
Exactly. Like starting with the point where you said they used to believe that it had a spiritual link or something. I remember that was an old age, right? I remember in eighth grade, one of my friends in school had fits because of some reason or the other. And a kid who doesn't know anything about fits would go on and say, "Isme to mata aa gayi. Isme mata aa gayi, ye pagal ho gaya." So that age old thing, and someone in eighth grade who doesn't know anything, that child is saying, "Isme mata aa gayi." It felt so weird at the time. I had the privilege of growing up in a family which talked about mental illnesses and mental health from the very beginning. So I knew that he was wrong. And once I went ahead and corrected him, that this has nothing related to that. This is something related to the body and the mind. And he was like, "No, you are wrong." My parents taught me it's my mata aa gayi hai. So I feel it's the lack of knowledge in people or the age old traditions and the things that they have been hearing that it's all that it has some relation with the spiritual or gods. It's ironic how much people believe in that stuff instead of science, which has all the facts, and medicine that has proved okay it can improve, but still they would rather go to a tantric than a psychologist. Same thing goes for the example that you gave related to the dentist. Instead of wearing masks, people would rather, they would rather drink some kava or something, and they would be like, "COVID isse nahi hoega." So yeah, it's because of the lack of knowledge and the lack of not education, but the lack of information that they get. Maybe that is why we still have a taboo around and still stuff like that is happening. Why do you think do you think that this is the reason that there are a lot of misconceptions related to mental health? The lack of knowledge.
There are a lot of reasons. First of all, we feel that if somebody has a mental illness, the person is weak. And the entire thing goes down from there itself. I mean, there is no way back. Because once you say that, why is this person, feeling so depressed? He has a big car, he has so much money, he has a good business, he has so many degrees and all that. But he doesn't have enough serotonin in the brain. That is why he is depressed. It is as simple as that. But why? Why will we connect something to the chemical receptors or the neurotransmitters in the brain when it is, you just do not see any other physical signs in the patient? We like to see, surgery happening and there is some lump in the body, and then you take out the lump and the symptoms go away. What if I say to a person who is, a heart patient, कि आपका दिल तो बड़ा वीक है, आप एक काम कीजिए, आप अपना घर पे बैठे रहिए. So this is somewhere acceptable. Because why? Because heart is something people feel is the most prime organ of the body. Without the heart, anything will go wrong. But people forget that the brain cannot survive without oxygen or without glucose for more than 3 to 5 minutes. It's just going to die. And it is going to die, and you cannot revive the brain back. It is impossible. We haven't been able to revive it. Even till now, we don't have any kind of technology to revive a brain back. But you can revive a heart. People have revived hearts after very long duration as well, after 10 minutes, after half an hour. These things have happened. Until the brain is not dead, you can revive the patient. If that line is not getting inside the head that the brain is important, you just don't need to take care of the heart. Heart is of course important. Without the heart, your blood is not going to pump, your brain is not going to get supply of the blood as well. But if by some reasons I can, try to supply some blood to the brain, and the brain is working, and I'm able to revive the heart, so you'll survive. But if your heart is pumping blood and the brain is not working, the brain is dead, you are just dead. There is no use of any kind of ventilator, because your lungs are not going to work, because the baroreceptors and the areas of the brain which is responsible for your respiration is dead. So your lungs don't know that they have to breathe in and breathe out. The voluntary involuntary processes that we do is all because of the brain. And once we understand that whatever mood changes that we have, whatever personality we have, is a part of the brain, and we separate out the mind from it, because we feel that the mind is weak, the mind should be strong. But what about the brain? So rather than confusing the brain and the mind, I think mind is something which we cannot see the mind, but we can see the brain. So making this difference of the brain and the mind, I think a lot of things can get clearer to people.
That makes a lot of sense. So what do you think? Like you said that people who should get information about mental illnesses, mental well-being, and psychology are not actually on Instagram, do not have the access to such technologies. How do you think, or what do you think should be a way to make them understand that this is real and this happens to a lot of people? Obviously, if a teenager thinks he's suffering from depression and he goes to his parents, someone who's not liberal, and he says that I think I'm suffering from depression, the parents are gonna, instead gonna scold him that why do you think such stuff, or it's all because of this issue or something like that. How do you make them understand that, yeah, this is real?
Well, this is a very challenging thing. And most of my seniors won't have any answer. Even I don't have a peculiar answer, because it is all random things that you throw in the pond for you to get the results from people who are so unaware about mental diseases. Because I just try to tell them whatever possible. If they are in front of me, if they're talking to me, if they are trying to consult. So I feel that at least they're taking one step ahead to at least understand what's going on. But if this outright, if they say that, no, there is no mental illness, and going to a psychiatrist is waste of money, and they charge bomb, and I think nobody can get into that, because if you don't have insight of the problem, nobody can like help you understand it, that this is the problem. But whoever, if some patient, if some teenager or somebody who is reliable on their parents for at least money, because most teens in our country, they don't work, we don't have that system where our teens are working. Like in the US, they work, they have a little bit of pocket money. And in India, there is no system of pocket money. It's like, how much do you need? The parents just give out, or it's something always random that you get some money, like 100 rupees, 500 rupees, and all that. But of course, if a patient is less than 18 years, they need a relative, they need a parent along. You cannot, I cannot ethically treat a patient without the parents, or without any guide, any person who's with them, any guardian. So for such people, the easy way to make them understand is that what exactly is happening in the brain. A lot of people understand that. My professor, he usually draws the brain. He draws the various parts of the brain responsible for, say, the movement of the body, for coordination, for balance, for hearing. And he tells that, all these things are the different parts of the brain responsible for different things. And there are these receptors, and there are these neurotransmitters. He calls it in Marathi, like I stay in Nagpur, so Marathi is the most common language here, Marathi and Hindi. So he says that there are these things floating in your head, like your brain is floating in these chemicals, He says taral padarth, which I find a very amusing word for me. So taral padarth means तैरते हुए fluids basically. So these fluids, because of some changes in these fluids, there are possibility of such changes to happen and such things to happen. So that's one way where patients do understand that, okay, well, if it is like that, maybe, we can see, maybe for a month or two we can take the medicines and we can go ahead with this. But then people again are scared with the side effects, that what will be the side effects, because we just think about the side effects of psychiatric medications, which there are side effects, of course, but not with low doses, not with acute problems. If you have a problem and you take care of it immediately, I can guarantee you this, that you won't be having a very horrible prognosis. You will get better, and you will have to be consistent with whatever you are doing. Even if you want to lose weight, if you go to the gym for 6 months and then you come back and sit at the home for another 6 months, you're going to look the same like you used to look 1 year ago, because you were not consistent enough. So the same goes with food, with washing your hair, with doing anything in life. You just need to be consistent. And if you know that this is the problem, if you know that, yes, my hair gets oily in 3 days and I do need to wash it on the third or the fourth day, and if you don't wash it, it's going to get bad. It's going to be smelly. It's going to be oily. But consistency, getting regular follow ups till the time a doctor is asking you, and that's it. And if you are scared of medications, there is therapy anytime for you. Just at least start with therapy. And then if your psychiatrist is telling you that, yes, you would need these medications, so a lot of times people do consider, at least out of 10, 6 or 7 people do understand if they are sitting in the OPD. If they are sitting at home, then that's the problem.
That the thing how you explained related to Brie and the fluid and the chemicals, that was actually very interesting. And I feel people who are not educated and who do not have access to resources like a lot of privileged people, even they could understand that way. So it was quite interesting. And it felt like, yeah, if someone explains it in that way, maybe people will understand, and people will move towards a shift from thinking it as a stigma and thinking it as a taboo to normalizing it. Do you think there is a relationship between mental health and physical health? So again, this is something that is very stereotyped. Oh, you're feeling depressed, just go have a walk, it would be fine, go talk to your friends or something like that. So do you think there is a relationship between mental health and physical health?
Absolutely. 100% relationship. It is not if but inversely proportional to each other. If you have a physical problem, if you say you got hurt, if you fell down and you got hurt, definitely there's going to be some kind of mood changes that you have. You will be feeling that pain. You would be, miserable, that why did I fall? Why didn't I walk properly? What was the hurry? And why couldn't I see that Papa ki chappal kept in between? So there are mood changes which are reversible. But if you are not fit physically, 100% your mental health is not okay. And if your mental health is not okay, however you look on the outside, or even though your blood parameters look perfect on the paper, it doesn't make any sense, because your mental health is not okay. You don't feel healthy. So it's not just physical health that we need to get into, that people do these blood tests every 6 months, every year, but nobody actually looks into the brain, if the brain is okay, if things are going well over there. Do I need anything? So I just tell people that, like, we say that you every 6 months you should go to a dentist. Every year you should get your general checkup done. Similarly, every just once a year you should just visit a mental health professional, talk it out, see if you need any help, see if things are fine. If not a mental health professional, one can go to a lifestyle physician. They can talk to them as well, where lifestyle physicians help you out with the normal daily activities which you can modulate to for a healthier lifestyle. So any kind of mental health disorder is going to affect your physical health, and you are going to have physical symptoms as well. Like in depression, you have various kind of aches and pains, like the somatic symptoms that we call them. There are headaches. People will complain about not feeling okay, or they are feeling some kind of pain in their leg or their stomach or their hand, which is otherwise you cannot explain any physical health issues with them. And patients go to the doctors that, "Mere ko, I have backache, or I have this ache and that ache." They get painkillers, and the pain keeps coming back. So this is the time where you do need to check the mental health as well. You do need to see that if the person is fine mentally as well, if they're having any sleep issues, if they're having any mood problems, if they're having any changes which are not normal for them. Because your normal and my normal is of course different. If I wake up at 6 in the morning and suddenly I'm starting to wake up at 10 o'clock, and you find me all dirty, I'm not, taking bath, I've stopped taking bath, and I'm not taking proper care of myself. There is really low personal hygiene, and I'm not talking to you. Otherwise, I'm a very cheerful person, and suddenly I've become this, very odd, and uh, I'm just not socializing with anybody. So this is an alarm because it is not normal for me. But if I am already a person who doesn't talk much, and if I don't keep smiling a lot, so people will know, okay, fine, she is this way, and it's nothing is wrong with her. But if of course you find some changes which are not normal according to the person, one needs to intervene that what is going on.
That makes sense. Everyone has a different normal. What
Right.
would be some do's and don'ts according to you for people who are suffering from mental illnesses or people who think they are suffering from mental illnesses?
Stop talking to your padosi wali auntie. Stop talking to people who tell you that, this is all in your head, and why are you taking medicines. There are patients who come back saying, I stopped taking medications because this person told me कि इसके ये side effects होते हैं. And the patient is now more worse than what the patient was a month ago, because they did not take their medications properly. Of course, their symptoms increased. So these people, I mean, I'm like, why do you tell people? Why do you want to tell people? And if you want to tell people, make sure that they understand what you're going through. You don't tell a person who's having diabetes or blood pressure that, "Oh my god, you're going to take this medication for life. You won't be ever, not relying on these medications." People take thyroid medication so often, people take diabetes medication so often, people take medications for so many other things as well. As asthmatic people always keep their pump. Nobody tells them, "Oh my god, your lungs are so weak, you need a pump to breathe." I can breathe very well, just try to breathe like me, try to live like me, do this pranayam, and you'll get fine. But there was a time when people were not accepting this as well. So stop listening to your aunties and uncles. Listen to your doctor. Talk to the people who you feel understand what you're going through, or at least help them understand, like your parents, your friends. Make sure that you are going on your appointments like on time. Follow up with your psychiatrist or your psychologist on time. Don't delay your treatment, and everything will be fine if you just follow the simple steps. The don'ts are just not getting into the societal, you know confusion about these diseases, and not listening to people on social media as well, where people tell that, this thing is going to cost you your loss of libido, or this is going to cost you loss of your personality. I mean, yes, many drugs do affect the libido of the person, but it is a reversible thing. It's not a permanent thing. It's not going to be there forever. But because we feel that if we lose our sexuality, or if we lose the ability to have coitus or do something with the person. So that's going to make people really very scared, and they won't take medications. If they're depressed and if they're not taking any help, they will definitely have erectile dysfunction or they'll have low libido because of depression, not because of the medications, because medicines tab tak हमने ली नहीं है. And whatever you put in your body, like the morning tea that we put, the sugar that we put, the rotis that we eat, anything in excess amount is does have its side effects. We just don't know what kind of side effects that we have. We are addicted to sugar. Every Indian is addicted to sugar. There is no Indian, a normal Indian. Woke Indians are not on sugar anymore. I know how bad sugar is, but it's very difficult for me to leave sugar because every recipe in our country, at least at my place, has sugar in it. At least like few grains of sugar is there. So you cannot eliminate these things as well. So thinking about the side effects, if somebody is scared of the side effects, and if you stop the medications on your own because somebody told you, please consult your doctor first for any problem. If you are on medications, if you are put on a dosage, there is a reason for it, that you have been prescribed some medications and one should follow it. It's not like you cannot pop it when you like it and just keep it in the cupboard when you feel like it. Just talk to your doctor, clear all your doubts. If you feel that you are not comfortable with this doctor, you can go for a second consultation as well to somebody else. Just find the right person for you and don't hesitate to ask as many questions as possible to your doctor, because there is that place where you can get legit things. But I do want to address this, that there are many doctors, sadly, many doctors, many senior doctors who are against psychiatry, or who say that you don't need psychiatric medications. This is another challenge from our own community to us. And people, because like general practitioners especially, who are practicing, who have so many families, I mean the entire family goes to this general practitioner or a family doctor. And these doctors are more, you might also have some family doctor which you go to for small problems like cold and cough, fever, and some tetanus shot and all these things. So these people influence us a lot because we have been looking at them since we were a kid or for a longer duration of time. So yes, you'll get doctors as well who will be like, you don't need anything. But if you read somewhere, there are newspapers where people post, write about mental illnesses. We have various camps in schools or in like district hospitals or in small localities where we just try to make people aware about the mental illness as well. So like on World Mental Health Day, there are usually some meetings and everything going on to make the general population aware about mental illness. So I think these are like the do's and don'ts, where don't skip your medications on your own. Whenever you have any doubt, talk to your doctor. Don't listen to aunties, and just be a very good patient, have regular follow-ups, and you'll be fine.
All of them feel so right, and rightly what, like, I feel the biggest do would be find the right doctor for you, and instead of going to other people, consult with them, because they
Right.
are the one who can rightly guide you. Unfortunately, because of the time limit, we would have to wrap up. I have one last question for you. What is some advice you would want to give to the future doctors and future psychiatrists who want to follow the same path as you?
Just do it. Stop thinking about the society, stop thinking about people, stop thinking that, my own family even says, even now, that will you get patients, or who is going to pay you? Will the patient pay you, or will the patient's relative pay you? Because they feel that every patient who walks in is a complete gone case, and they have no insight at all, and they are incapable of earning, incapable of working, or incapable of doing anything for themselves, which is 100% false. There are very less patients who are completely dependent on somebody. Yes, mental health do causes absenteeism, but that doesn't mean that they are incapable of doing anything for themselves. Just follow your heart. If you really love doing this, only then get into this profession, because it is difficult, be it a psychiatrist or a cardiologist or a gynecologist. Only if you want to dedicate your life and if you really are passionate about it. Otherwise, don't get into this, because it's not an easy job. It's not easy to be a doctor, and that's not for somebody who have different aims in life. So I think that goes for any profession. Only if you're passionate, only if you feel that you want to learn medicine. It's people feel that it's about serving people, but at this age where we have like very vivid types of people who also beat the shit out of doctors as well, you cannot keep serving people. You need to serve yourself first.